Okie dokie. In which case, everybody, welcome to the People Committee. I remembered where I was, which is a good start to the meeting. I'm Mary, I'm the chair of the committee. I won't introduce myself as the chief like I did last time, which wasn't a great start to the meeting. Nonetheless, though, you're all very, very welcome. A special welcome, I think, to our 2 new people as well, to Lindsay, who's new to the organisation. Well done. And you've been, I think, dropped into it as well, Lindsay, which is always welcome.
Thank you.
Good luck with your new role. It's nice to see you here. And also to Bruce, who's in a new role as well. I don't think, Bruce, you're being quite dropped in it the same way, but you're very welcome nonetheless.
Thank you very much.
And other than that, I just want to remind everybody about what I think is being referred to now as meeting hygiene. However, nonetheless, if we can make sure that our microphones are on mute unless we're talking, and to use the raised hand function, that would really help. I don't think there's anything else I need to say just now, other than, again, just to repeat, you're very welcome. In terms of our apologies, I've got a note that Scott's not able to be here, but Lindsay's covering for Scott. Is that correct? And Julie's not here, but Jim's covering as well. Is that correct?
Yeah, that's correct, Chair. Yeah, so Julie is our acting head of safety and assurance. She's not here, but we've got Jim Holden, who's health and safety assurance manager in her place. Thank you.
Thank you. So on agenda item 3 then, are there any items that you feel should be taken in private, or those that are proposed to be taken in private that you don't think should be? Is everybody content that that's correct? Excellent. I'm getting nodding heads, so that's good. And then moving on to then agenda item 4, declarations of interest. Are there any declarations of interest? Seen shaking heads. Nope. Okay, then if we can move on to agenda item 5, then that's the minutes of the previous meeting on the 9th of September. First of all, in terms of accuracy, are there any items of accuracy? If I go through them, what would be page 4 of your packets, or page 1 of the minutes on the first page, on the second page, on the third page, 4th, 5th, 6th, 7th, nothing? Excellent. That was a long meeting, 7 pages. Are there any matters arising that anybody wants to raise? No. Excellent. Are we content then to approve? Yes. Excellent. Thank you very much, everybody. We'll move on to the action log. Ali, that's with you.
Thank you, Chair. So just refer to page 12 of your pack, the rolling action log. Members will see that there's 2 actions on there, both of which have been marked blue as completed, and that related to item 8.1.1, which is the Building the Futures Together, and item 14.3.2, which was items for consideration of future IGF board strategy meetings. So just to confirm, the committee are content with the position statement updates and for these to be removed accordingly. Thank you, Chair.
Thanks, Ali. Are we content for these to close? Yes, so they can be removed. Thank you, Ali. Okay, we'll move on then to item 7, and that's the performance and risk reports for quarter 2, and we're going to take the pod one first. So I think that's over to yourself, Lindsay.
It is indeed. Thank you very much. Just a couple of points to highlight for the committee before I pause to invite any questions or observations. The team is carrying out some ongoing work to review the format and content of our reporting to make sure that it meets the needs of the various fora, and we have started some engagement with the business intelligence team to look at how we can improve the way in which the information is presented. So really just to highlight to the committee that you can expect to see some further changes and improvements in the reporting as that work progresses. On section 1 of the report, as discussed earlier today at RANSC, we continue to be at a bit of a stalemate in terms of TU engagement on harmonisation of the RVDS terms and conditions, but are looking actively at next steps in terms of engaging with that colleague group to move the discussion forward. We've had some positive impacts from the harmonisation of instructor T's and C's, notably the January firefighter intake is going to be delivered on a 4-on, 4-off shift pattern, which is allowing us to continue complying with COVID regulations, but to increase the number of trainees who are able to come through that process. And in terms of support staff pay, we are still waiting for an update from Scottish Government on the outcome of the pay case, which was submitted some time ago. And Liz has a call this afternoon with the sponsorship team, so we're hopeful of an update fairly soon on that. From a health and wellbeing perspective, there's good progress happening in terms of clearing the backlog that built up during the early days of COVID in terms of our routine health and fitness assessments. And we've also had over 380 colleagues attend the Lifelines mental health and wellbeing training, which is a terrific number to see coming through, and the feedback from the participants has been incredibly positive in terms of the benefits that they're taking from that training. On section 2, I would just highlight, it's noted in the report that the highest number of disciplinary cases relate to code of conduct. There is some manager training happening through the business partnering team to increase capability within our manager cohort of dealing with these issues, and that will also be supported by work under the Building the Future Together programme. And finally, there has been an increase in our absence rate to 5.2% over the period of the report. That is largely attributable to an increased number of COVID cases, and the rate of that increase is in line with Scottish Government figures in terms of what we're seeing in wider society, as opposed to anything disproportionate happening within the service. So I'll take that opportunity to pause and invite any questions from the committee.
Thanks, Lindsay. And my apologies, I should have asked you, just for the sake of particular new members, and also myself, Lindsay, because I'm still getting to grips with everybody, to introduce your role, but as you're new, we kind of know who you are already. Malcolm, do you want to come in first, my dear?
Yeah, thanks, Chair. Yeah, Malcolm Payton, board member of the People Committee. Just one area I'd like to ask a bit more about, and that's under the mental health strategy. I see there's information about thematic subgroups, which I thought was really interesting. I would just like to get a little bit more insight into that, whether they are, I don't know, basically strategic, whether they're helping with policy, whether they're helping with communication, whether they're leading actions, sort of how does that work? And in relation to that, would it be helpful to bring out a kind of single page at some point listing these groups and what their remits are, sort of thing, just to give us a bit better insight into that? Thank you.
Thanks very much. I've just seen Jerry's hand pop up, so I'm not sure whether Jerry was looking to come in on that rather than me responding.
I can do that. Thanks, Lindsay. Thanks, Malcolm. Under the mental health and wellbeing group, as you say, there have been a number of thematic groups either established or about to be established. There's one that's been in place for some time now, which is the suicide prevention subgroup, which is led by John Miller. However, more recently, we have established a document and policy review subgroup. So that group is looking at largely all our documents, policies, procedures, and so on and so forth. The ones that touch on people aspects and how those might impact on people's mental health and well-being. We are about to establish a wellbeing and inclusion subgroup, which is going to look at, it's effectively, well, part of it replaces what was the COVID wellbeing group, but that group's looking at the kind of longer term health promotion, all the activity that we have on a regular basis around health promotion. We are about to establish a wellbeing champion group and a wellbeing champion model, which is also mentioned in the report. And the other one we are about to establish is the training and development subgroup. So these groups will be looking at those particular areas, and we can certainly bring something forward next time if that's something that the committee would like in terms of the work of these groups. So the intention of these groups is to look at those particular themes and how they relate to the mental health and wellbeing strategy. We're also talking about establishing a community subgroup that will look at the links between the work that we do internally, but also the work within our communities in terms of mental health and wellbeing aspects. So that's a very rough overview. There is likely to be more added, and as those ones end as well, as we work through the strategy and the different strands that we're looking to target over the coming years.
Okay, no, thanks, Sherry. That's really helpful. I suppose we're just interested things like the Wellbeing Champion Programme. Is that, you know, is that to identify more champions, to support champions, to well, I don't know, just to get some idea of, you know, in a sense what they're trying to drive towards in these groups.
Yeah, so at the moment we have an informal champion model that's really only within service delivery, and that is people who have a responsibility within service delivery areas for ensuring the health and well-being and looking at how they can support the well-being of employees in those areas. But we're about to launch, it will be launched next week, the formal well-being champion model, where we'll initially look to select about 100 people, appoint about 100 people, so we can make sure that we've got at least one champion in every directorate and every service delivery area. But the ambition in the coming years is to increase that quite significantly, where we plan to have champions effectively in every watch and every team. So initial programme is to try and make sure that we've got some representation within every directorate, but certainly significant expansion in years to come.
Great, thank you. That's very helpful. Thanks, Chair.
Thanks, Malcolm. Jerry, just before we go to Steve, can I ask you to give me a little bit more context in terms of how are you measuring the impact of those rollouts of champions?
So at the moment it is at the early stages, because I say that the one that's in place at the moment is one that was historically led by John Miller in the early days of his development of the strategy. But moving forward, we intend to have quite a significant training programme for these champions around all the particular areas that we want them trained in, and also how they will continue their CPD, if you like, so that we make sure that the training is ongoing. We would also intend to have things like that, a kind of peer support group for them, where there is opportunities for them to work together and to feed into each other in terms of what they're learning from it and what the successes are. But part of the remit of the subgroup, as I say, it's only just been established, and that their terms of reference hasn't been developed yet. But you would expect, we would expect that terms of reference would include how we will be evaluating and monitoring that programme, and part of that will be among the champions itself, but it will also be in all our other data and survey information that we'll carry out in terms of what impact are our resources and themes and investment, what impact is that having on our workforce in terms of their mental health and well-being, what impact is it having in absence, and so on and so forth. So we will be looking specifically at how the champions are adding value, but we'll also be considering what that looks like in the wider context of everything we're doing around the strategy.
Thank you. Steve, just before we come in, can I just ask you to make sure that you do introduce yourselves for the sake of the individuals who may be watching this online. So I'll pass over to Steve.
Thanks for that reminder. So Steve Barron, board member of the People Committee. So I enjoyed the report. Thank you very much. And like Malcolm and Mary, I'm particularly pleased to see reports on the mental health strategy. And Jerry, I thought you answered the questions very well. I've got, having said that, I enjoyed reading the report. It is 44 pages long, which seemed to me to be a stretch. And I'm going to challenge the team to see whether or not you can give us the same information in shorter form. That would be my preference. Of course, I'm only one committee member, but nevertheless, I would like to see it presented in a more concise fashion if that's possible. I've got 3 questions. The first one is at 141, where we're talking about the positive action events. I'd be interested in hearing about the impact of that and whether or not we have any information to show whether or not that's working. Then at 3.2 and 3.3, both of those tables have got a description that talk about processes that have been concluded within 6 weeks. I didn't quite understand why the concluded within 6 weeks was relevant. Be helpful to have that explained. And then finally, at 3.5, there's a note that 329 employees left in 6 months. Now, I couldn't cross-match that to the turnover rates quoted elsewhere in the report. They didn't seem to align. 329 in 6 months is a large percentage, and the percentages shown elsewhere were smaller. So be helpful to have that explained. Thank you.
Thank you very much, and apologies for not introducing myself formally earlier in the meeting. So I'm Lindsay Gaia. I recently joined the service as Head of People in OD. The positive action events, I will invite Rachel to jump in with anything that she wants to add. A lot of the events were fairly recent, so it may be that it's quite early days to have any specific outcomes in terms of application numbers or successful applications, but I'm sure Rachel will be able to share some insight in terms of the feedback that we've received from the participants on the quality of the events.
Yeah, happy to come in there. Thanks, Lindsay, and thanks for your question, Steve. Rachel Scott, Deputy Head of Pod. It is fairly early to fully assess the impact, as Lindsay said. We started a programme of events for our women, ethnic minorities and LGBT communities over the last kind of 6 to 9 months, and have ran, I think, upwards of 10 or 11 events so far. In terms of our whole time process, it is a rolling process. So we've got a number of individuals who have perhaps started to go through that application and selection process, and others who are still considering the role. But that is something that we're currently evaluating at the moment in terms of the impact of the events. In terms of the content of the events and the feedback from participants, it's been extremely positive in terms of the information that's been made available to them and the onward support that comes from those events themselves for those individuals. Where we now want to focus our attention further is on more detailed engagement and outreach, because what we've found is quite a number of the individuals coming to the events have in some way, shape or form already considered a career in the service from those underrepresented groups, which is great, you know, and we're still obviously keen to fully engage and support those individuals in considering an application with us. But I think for me, we need a lot more focused engagement in terms of those who haven't yet considered a career and looking at the barriers, potential barriers or perceived barriers from those communities. So that is where, in terms of our positive action in recruitment, our focus is likely to be, and working quite closely with our service delivery colleagues in terms of our approach to that and the engagement that they already do across our communities and their local knowledge in terms of doing that. So still further evaluation to be undertaken, Steve, in terms of the detailed impact, in terms of what that will look like in terms of our workforce profile, and also where else we can direct our positive action activity. So for example, we touched earlier on RVDS, and obviously in terms of recruitment within the RVDS cadre, there's obviously an opportunity there too for us to focus our positive action initiatives too. So lots more to come on that, and I hope that's answered your initial question, Steve. Thanks.
Yes, thank you, Rachel. And it's clear we're on the same page, because from a board and people committee perspective, we will focus on is it working rather than what are you doing, if you recognise the difference.
Absolutely. Thanks, Steve.
Thanks. And if I can just come back on the other points that you raised, Stephen, thank you very much for bringing those up. The rationale for referring to the number of cases concluded within 6 weeks is that our policies give that timescale as our aim in terms of concluding processes. There are occasions where, for example, a case is particularly complex, or, for example, periods of annual leave or the availability of representative body members to attend meetings may cause it to go beyond 6 weeks, but we report on the number concluded within 6 weeks because that's stated as the target timescale within the relevant policies.
So are there others that aren't concluded within 6 weeks that aren't being reported then?
I will check for you, Steve, in terms of whether there are cases, and if so, how many that have gone beyond the 6 weeks. I think that's a very valid point, and also to understand the rationale. Was it, for example, that there was a number of individuals on periods of annual leave that caused the fact-finding process to be longer, or were there some other issues that caused us to go beyond the 6 week period? With regard to the 329 leavers within a 6 month period, and tying back to the turnover rate, unless Jerry or Rachel have got an immediate response to that, I'd like to request the opportunity to go and take a look into that and provide an update to the board out with this meeting. And in terms of the length of the report, there was some work done by the team recently to review and streamline the reporting. A lot of similar information was being reported to different committees and boards, so there was an attempt to consolidate that and have a standardised set of reporting. What that led to is the creation of a quarterly report, which the committee would have seen at its last meeting, and a 6 monthly report that contains a greater level of detail. We did have a conversation actually within the Directorate recently about whether the 6 monthly report is too lengthy, and perhaps we look to do the quarterly report 3 times and we have an annual report following the end of the year that provides you with more detail in terms of the annual performance. And as I mentioned earlier, we're also very keen to work with the data and business intelligence team to look at ways that we can present the information more concisely, more visually, and in a way that makes it easier for the audience to engage with and digest. So I would ask for the committee to bear with us while we work through that process, and certainly to expect to see more streamlined reporting as we move forward with that piece of work. But if I've understood correctly in terms of the feedback today, certainly an ask to scale back from the length within the report that's in the papers today, and I can absolutely take that away in action.
Very helpful, thank you.
Lindsay, just to come back as well, I think that I would make a plea that you don't do that in isolation from conversations with the committee themselves, because we do. I think that Liz is aware, I don't think she's on the call yet, that we do have put in pause to some extent because of the current workload, but that there is a need for us to have a look at whether or not the information coming through the reports is actually answering the question that Steve raised earlier, which is about what is the impact of the activity rather than the impact itself, or rather than the activity itself. So if there are reviews ongoing, then I think it would be useful to make sure that the committee are involved in terms of feeding in what it is that we would find useful coming through those reports. And I would echo Steve's point that the report itself is incredibly long, particularly without a covering report that would allow us to know what particular are the summary points that we need to be particularly mindful of in our scrutiny processes. But there is an ongoing dialogue, I think, that's to some extent off table around elements of that. Malcolm, sorry, you want to come in?
Yes, thanks. It was just to reply on about Steve's point about the number of grievance cases. I'll leave it to the executive team to give a formal reply if appropriate, but certainly we have in the past seen ones that have gone beyond the 6 weeks. So I am pretty confident that if any went beyond it, it would be listed in the report there, and that is the total. But as I say, that obviously I'm not in a position to answer that formally, but just to give you that bit of reassurance from my past experience. Thanks.
Okay, just before we move on from that point, can I make a small pedants point as well, Lindsay, which is just around acronyms. I know that there's a acronym table at the back, but there is an inconsistency in terms of how the acronyms are used through the report, which, if given that it's a public report and we can't guarantee that all individuals will follow, particularly what MSK means, but there are other examples in there too. It's just something to be mindful of. I know that's just a small point, as I said. assuming that there are no more points from the committee or queries or questions, we shall move on then. And I think it's Kenny, you're picking up the area for training, safety and assurance.
Yeah, thanks Chair, and good afternoon committee. I'm Area Commander Kenny Barber, Head of Training Delivery within the Training, Safety and Assurance Directorate. You'll see from the report that it is broken down into two parts. I will provide the overview of the first part around training, and happy to take any questions before handing over to my colleague Jim Holden, who will give the overview on the safety and assurance element. So the report that's been published covers the reporting period for Q2 of 21-22. And if we probably touch on first the risk movement, I think, again, just reporting that all the risks remain static. However, they are very relevant, I think, and probably in light, particularly recently, of the new variant coming up online, and I think that we need to be cited on that it could still have a pretty potential impact on us. So the risks and control measures to mitigate are very relevant. Looking on just at some of the key successes from within the report, over the reporting period, we trained an additional 48 new retained and volunteer duty system trainee firefighters, and also subsequently a further 50 went through their breathing apparatus element, which makes them fully available for operational duty. In terms of our whole-time cadre over the reporting period, 36 whole-time trainee firefighters passed out from the graduation at the National Training Centre, with a further 11 at our Newbridge Training Centre. So for the reporting period, a total of 47 new firefighters are now on station and actively being deployed. Another key element was the training that we delivered primarily in preparation of COP around marauding terrorist attack response. I will touch on that in a wee bit more detail when we cover the spotlight. But I think there's probably a general theme throughout the report around how we put a prioritised focus on COP26 in general. It has had an impact on some of our stats, and I'm happy to go into them in a wee bit more detail. But I think what it demonstrates is the ability to be agile and deliver on a risk-based approach to ensure that we're there and able to support the requirements of the organisation. And I think another key element I'd like to just touch on is the review that's ongoing around the training for operational competence, in particular the amalgamation of some of the modules, which also links into a later report around the HMFSI thematic audit report. So it aligns with one of the actions that in 7.1 that's contained within that, but again, happy to touch in a wee bit more detail. So if we can look at the spotlight risk, so with COP26 having taken place, the intelligence was there to show that there was an increased risk of a marauding terrorist attack taking place, and to enable our organisation to respond appropriately, we had to conduct quite a significant piece of training that was delivered in 3 different ways. We delivered technical input across a number of volunteers from our flexi-duty officer cadre, and also a number of volunteers from 3 of our community fire stations across the country, in Aberdeen, Glasgow and Stirling. Whilst the figures that are reported in the paper are for up to the end of Q2, I think it'd be worth just advising the committee that we did actually enhance the numbers to provide the total response that we trained in terms of that, because some of it rolled into October, so it will fall within the Q3 reporting. But in total, a total of 233 personnel split across whole-time fire stations and our flexi-duty officer cadre were fully trained with the support of our partners from Police Scotland and the Scottish Ambulance Service to allow us to have the appropriate response to such an incident. If we move on now to the operational core competence, again, it's mostly static. However, you'll see that we have increased in terms of our volunteer duty system. And I know that that was a question from members at the previous meeting, and work was done. And I think it's worthy of note across the whole of our duty systems that, as well as undertaking the additional ask in preparation for COP26, the maintenance training was also still able to be maintained and carried out. So again, the agility, flexibility and the willingness to do by all of our firefighters and crews at station is to be commended. Unfortunately, there was one negative element, and that is in terms of our flexi-duty officer cadre. You'll see from the report that there was we are reporting a drop in compliance around that. It's worthy of note that we have taken on or temporarily promoted quite a number of flexi-duty officers within the reporting period. So that's had an impact on the reporting figures. With them being new and coming online, it has impacted. It's also worthy of note that our flexi-duty officer cadre undertook a significant amount of training in preparation for COP26, not just around the marauding terrorist activity, but in preparation for their attendance at venues, overviews of venues, are just some of the examples of some of the activity that our staff have undertaken that has utilised up quite a significant part of their capacity, as well as their business as usual day-to-day jobs, and also responding to incidents. If we move on to the incident command competence, again, it's worthy of note that there has been a bit of a drop in terms of the reporting. However, whilst the report might show a slight reduction across the duty groups, it is worthy of note that the competence doesn't just lapse. We are maintaining that. We are demonstrating that maintenance through the recording within our training systems. So any operational incident that commanders attend and crews attend, it is being recorded and reported on to maintain their operational competence. It's also worthy of note that we undertook an assessment of incident command competence to support a supervisory managers process for fledgling crew commanders. So there was circa 250 new crew commanders that were assessed and are now being added into the system. So it's worthy of noting the fact that these people were assessed by the same people that would be doing the current assessing of in the reporting period. So that's had a bit of an impact just around capacity. But the significant positive is that we now have a further 250 crew commanders that are able to provide additional resilience to our operational response. The other part I would like to just touch on, and I'm sure all members are aware, I touched on it at the previous meeting around the innovative solution that we had to deliver instant command training for our flexi-duty officers. The previous reporting quarter, we had shown a dip in that, but you'll see from this reporting quarter that we're now starting to bear the fruits of that innovative online instant command training and assessments, which is now demonstrated that is going in the right direction, and we are able to do that recovery piece that we had advised members that we would do. I think the final bit I would just like to touch on in terms of the instant command assessments, we've been doing a significant piece of work as to how we can marry up our operational ops assurance piece, where we have officers that attend incidents and give an overview and a review of the operational activity at that incident, and in which point they also have an opportunity to assess the competence of the incident commanders that are on scene at that point in time. So produced a policy that will tie these two elements together and allow us at scene to re-accredit our instant commanders at that point during lifetime, which will be of a significant positivity to the organisation, and it will free up some capacity, and it will allow people to be assessed actually at lifetime rather than via simulation. So again, you're getting a more accurate and true reflection of the capability and of the individual. If we can move on to the specialist rescue elements, I think it's probably one of the real success stories of the report. I think there's a number of the indicators there that have shown an increase. A lot of it is around the preparation and the primary focus that was put in to COP26. Heavy rescue has started to show an increase, and a lot of that is down to, again, the hard work of the team and the production of a continuous professional development module to support all our staff at our heavy rescue stations, which has shown that increase. The decrease that's been demonstrated within the urban search and rescue is unfortunate in committee. It is generally just around the impact of COVID. We have had a number of courses within that subject matter that, unfortunately, due to candidates taking ill and other means that are COVID related, that excuse me, unfortunately we had to cancel the reaccreditation courses, which has led to the downturn there in that particular indicator. However, these are now scheduled to take place within Q3, so I'm confident again that we will show and demonstrate an upturn. And I think probably the big success, and I think you'll be able to see that, is the mass decontamination. There was a real concerted focus to get that back up and to a realistic and appropriate level, with a real focus put on in there. Opposite that, Chair, that was the main key points that I wanted to tease out of the report, but I'm more than happy to take any questions and go into any more detail as required from any of the committee members. Thanks.
Thanks, Kenny. You've managed to pick up, I think, on most of the questions I had. And congratulations on the increase in mass decontamination. That was quite a significant increase there. I'll ask Malcolm to come in first.
Right, thanks, Barry. No, thank you again. Hugely detailed report and huge amount of information there, and thanks for your comments on it that really drew out some of the highlights. And I don't underestimate the amount of time it takes and the effort just to maintain some of these things at the same level. You know, we sometimes pick on one that's dropped or whatever, but there's a huge amount going on maintaining that. Just one sort of thought or challenge in among there. You talked about the prioritisation due to COP26 and things, and absolutely correct, and the kind of impact that's had. What tends to get reported to us is something like this that's historical. It says this was the impact and this is some of the reasons, and that's absolutely right. What I just wondered is how good are we at anticipating some of these impacts? So, you know, you're looking at COP26, looking at the training. How good are we at saying, now this is going to have an effect on training, it's going to reduce our capacity, so we think these numbers are going to reduce in advance, so to speak. I appreciate that might not be part of this kind of report, but just, are we getting that balance right of spending time reporting what's happened and putting some energy into going, look, we think this is going to have an impact, folks. What are we doing and how do we manage all that? Thanks.
Yeah, no, thanks, Mark. It's a really good point, and we've actually put quite a considerable amount of work into that in recent times by upgrading and the detail and data that's contained within our systems, primarily to look at a lot of the team types that's required for each of our stations, so we can look across the whole of our estate and identify each of the stations and what specialist skills and attributes are required for each of these stations now, and what the skill sets are aligned to each of them. What we can then do is by drawing on that report and overlaying that with retirement profiling, etc., we can identify what the gaps are going to be for the following year. That piece of work then feeds into our annual training needs analysis, And by doing that, it lets us identify what the requirement is for before we start for the following year. We can also draw down on the report of what the reaccreditation programme is going to look and feel like for that year. So when you start to knit the two things together, it allows us to look and then align that with our capacity analysis to allow us to plan and schedule for the requirement. There is obviously elements that we need to be agile and allow us to deliver, and I think, you know, we contained that within there. We've de-risked the organisation and we've enhanced firefighter safety, for example, by the introduction of battery-operated hydraulic cutting gear. Again, that's all been down and fed back in as the equipment became available via suppliers. So we can do as much planning and forecasting as we can, but we do know that we need to be able to be agile to react as and when, and that's where that risk-based targeted approach would come in.
No, that's really helpful, thanks. That's exactly what I was hoping to hear and expecting to hear. Thanks.
Steve?
Thank you, and thanks, Kenny. Some good stuff in there, particularly note the work to increase the capacity and throughput of training, which is clearly a big requirement for the organisation, and good to hear about the MTA results as well as the things that you brought out in your verbal report. So could I offer you the same challenge as I offered the previous report? This was a 37-page report. Now, last quarter it was 36 pages and the same challenge was given, so instead of it getting shorter, it's got a wee bit longer. So can I offer you the same challenge? We'd like good quality information, but we'd like it more concise, or I would. I've got two questions. At 4.5, I note that the compliance target for RDS and VDS staff is significantly below the 95% compliance target, albeit it is improving. So if I've read that right, is 95% the target, and is it genuinely the case that we're at 66 and then at single figures for VDS? And if I'm right about that, how worrying is that? And secondly, at 5.1, there are lots of reds in the report, and as a board member, red traffic light tends to draw my eye. But having looked at it more closely, the way I'm seeing it is that there's good work in progress going on there, and okay, it hasn't completed yet, but it's only partway through the year. So I wondered, is it a fair representation to be marking that as red, or is that actually kind of more on track than the report would suggest? Thank you for that.
Yeah, I'll let ACO Dickies maybe want to come in.
Chair, it's just on that last point Steve's talking about. Steve, that's if I'm picking up correctly, that's the health and safety, which you've not had yet. And I'd rather we let Jim do that part of the report. And that this report is 37 pages over two parts of my directorate. But I do take on board your request, and I will do our best to try and collapse that some. But some of the points that we've covered in each of those reports have been specifically asked for by board members in the past, but more than happy to take it off table with the committee, yourself and Mary, and do that other piece of analysis. But the containment of the content of both these reports have been generated from what's been asked for in the past.
Board members are fickle, John. I think you probably know that. So I
No,
apologise for that. And,
you say that
for my
almost
part in it. And also, Jim, I'm sorry for getting ahead of myself and asking a question about your report that's still to come.
That's just a heads up then, Steve, for Jim when we get to that point. I think there's I'll come back to the point about the paper length in a moment or two when we get to the end of the item. But Kenny, do you want to pick up the point under 4.5 then?
Yeah, I touch on that, Chair. Thanks. So I think some of that it doesn't raise concern. I think it's probably hopefully the first part to try and alleviate any angst. I think that a lot of this will touch in, Steve, to the work that's ongoing as part of the continuous improvement programme, where we are looking at and revising the whole of the content around the training for operational competence. and the number of modules that's been asked to complete it, the timescale that's available, and how that's going to free up quite significant capacity, primarily within our VDS element. There isn't a bespoke VDS training plan, as I'm sure I think I touched on it at the previous meeting, and there's some contractual elements to that. So that is the work that's done and what's reported on. But in terms of the figures, it's not raising huge concern that the work's going on. But I do think that once we launch the new training for operational competence on the 1st of April, and that new timeline and the layout of the modules where they are all bespoke to the specific stations and the risks associated with the stations, I think that will greatly assist in the reporting that's there currently.
Thanks, Kim. And just to confirm, you said the 1st of April as well, so there's no concerns at this point in time about workload and that being pushed back? No,
no, Chair, that is a prioritised focus for that section of the training team. They are working through that. We've got support from colleagues within service delivery to enable us to rebuild these modules, and we're very confident that we'll remain on track to deliver that on schedule.
Thank you.
Thanks, Steve. Are there any more questions in relation to this section of the report? In which case, just to say thank you for that, Kenny. And we will come back, as I say, to the report length in a moment or two. But before we do that, Jim, do you want to introduce the second part?
Yeah, thank you very much, Chair. I'm Jim Holden, Acting Deputy Head of Safety and Assurance, and I'll provide a summary on the health and safety section of the report, starting at page 78 of the meeting notes. So the first section considers our annual improvement plans, which we've recorded a 60% completion to date, and that's an increase of 15% compared with last year. Some really positive trends in relation to the North SDA and service development, with 100% completion rates for those, and greater than 85% for TSA and SPPC directorates. I take on board the comments made by Steve. I think the red, amber, green we have in place at the moment is anything greater than 80% shows as amber, and then the green at full completion rate. So that's the reason why there's a number of reds there. However, beside that, you can see the progression towards completion, which gives probably a better idea or flavour of how much work has been done and how close we are to getting those over the line and completed. So hopefully that provides a little bit of context, but I do take on board the comments about the red, and we may look to adjust those parameters slightly to better display the progress that's been made. So thanks for that. So moving forward with the report, a 2-year trend for all events remains positive, with the exception of acts of violence and vehicle accidents, which have a slight increase reported over that period, and we'll consider in more detail shortly. Specifically in relation to our key performance indicators, I'm starting at page 83 of the meeting notes, in relation to accident injuries. When compared to Q2 of last year, improvements are noted across the board. Over a 2-year period, a slight increase in trends are noted in the East Service Delivery Area Pod and Service Development, although these numbers are very small in terms of increases. In relation to RIDOR reportable events, we'll continue to note improvements with 50% fewer reportable events in Q2 compared with the same period last year. It should be noted 2 of those reports related to specified injuries, which we have identified in relation to door entry and gaining entry to premises, and a slip and fall. But again, small numbers, but we're still maintaining a focus on investigation and improvements in those areas. Moving on to COVID riddors, again, significant reduction in workplace transmission, which I think is testament to the continued controls that are being implemented across the service, and we hope to see that maintained for the time being, to continue to control in light of recent news in terms of new variants, etc. In terms of the accident injury breakdown, operational incidents notably occurring during development phase of incidents, which are kind of can be expected. However, during the causing stages of incidents has been identified as a slightly higher again, and we are looking into that, and sort of re-emphasises the need for maintaining vigilance right to the close and the completion of incidents. So we're working to push that message forward. Non-operational incidents, show a gradual decrease over 2 years. However, an increase is noted this year, and some of those events relate specifically into fleet staff involved in some accidents. In relation to training, accidents continue to decrease, although we have seen a slight increase in relation to compartment fire behaviour training, which we are continuing to monitor and to try to identify if there's any specific issues that we can address there. Moving on to working days lost. I guess one of the key challenges we have in relation to working days lost is the submission of information in relation to that. So you'll note in the top corner of that page 89 on the chart there, the nil return for that stat, which then has a knock-on impact on the accuracy of the other information. So we're working hard to make sure that we can provide a clear picture in terms of working days lost caused by accidents and injuries. In relation to accident causation, again, I mean, the causations remain fairly static. There is an exception there with hot and cold making an appearance on that list. 3 of 8 of those relate to operational incident, and 4 of the 8 in relation to training, which links back to the previous statistic in relation to compartment fire behaviour training. So we'll continue to scrutinise and monitor those stats. The final one in that area was in relation to a burn in a station kitchen. So as I say, those will be scrutinised and looked at in more detail moving forward. Near miss recording continues to decrease, with the exception of the West SDA. However, it is reflective of what we're seeing in relation to RIDDOR trends across the service. There's been equal number of near miss events reported both on and off the incident ground, and we are working on an employee fact sheet in relation to promotion of near miss reporting to try and improve that statistic. Acts of violence we've noted have increased over the last 3 years, and of note this year in particular with the East SDA. So we're working with our colleagues in the East Service Delivery area to evaluate any trends and issues around that. And finally, in relation to vehicle accidents, an ongoing increasing trend, with the main cause as been discussed previously in relation to low speed manoeuvres. We are doing a number of pieces of work around that, and have an interactive module that's drafted and due to be issued in the near future, as well as some information through operational assurance on frontline updates. There are further details in the appendices of the report for the SDAs and the Directorates, but that's a brief overview of the key information, and I'm happy to take any questions. Thank you, Chair.
Thank you, Tim. Nobody's hand's going immediately up, so I'm going to ask you a couple of wee things, and then we'll come back to Paul. First of all, I just wonder, what are the finance and contractual services doing about their wee accidents. They've had a wee peak there, but that's a minor thing. But I guess there was just a point on page 91 or 33 of your report. It mentions that there were some good trends in relation, I think, to the northeast and west, but it seems as though north was going in a slightly different direction, but I may have picked that up wrong. And I think you've mentioned it already, so it's not a major issue. But it was more the acts of violence one that I particularly just wanted to raise. And it was really interesting seeing that broken down by the different directorate areas. And I suppose particularly in light of Bonfire Night, obviously just having passed. And I don't know if there's any sort of verbal update in terms of what you're anticipating coming out from Q3, but it would be really interesting as well, and this might be a question more for John, I don't know, to better understand whether or not we are targeting comms and communication engagement around the acts of violence messages, particularly into the East area as a result of the intelligence that's coming through. So it was just the acts of violence one that, if Jim, I can ask you to come in, and then we'll go to Paul.
Yeah, certainly. Excuse me. We had a presentation on to the National Safety and Assurance Board on some really good partnership working that took place in Ayrshire. That went up through the board and is currently going through governance. So what we're looking at is how we apply that principle and that approach across the service. And as you say, once we have that in place, then we could focus it more specifically on the key areas that are causing us concern. So that's our initial approach, and I see John's put his hand up to come in there as well.
Thanks, Jim. John, do you want to come in?
Thanks, Chair. John Dickey, ACO John Dickey, Director of Training, Safety and Assurance. Mary, particularly on that point that you've said about acts of violence, it's, as Jim's rightly said, we had a presentation at the last NSAB board, which was the Ayrshire Pledge, and it was a multi-agency approach to reducing acts of violence against emergency workers. But we do target approaches on each of the areas. And in the run up to November the 5th, Stuart was, in his role as Director of Service Delivery, was given interviews, etc., and focusing on, you know, interfering with crews, violence to crews. We also there was a lot of communication and engagement went on, and that goes on throughout the year. But there's definitely a focus when it's around about November the 5th, end of October into November. So I think we do a lot. And there's a lot getting done in the areas in service delivery, but in particular this one area in the Ayrshire Pledge, and that's, as Jim's rightly said, it's going through the process now of coming up through, and it will be spread across the rest of the service delivery areas.
Thank you, John. Thank you, Jim. I think Paul, sorry, was next.
Thank you, Chair. And with your indulgence, I'd like to make 2 or 3 different points, if I might. Jim, that's a really good report again. Thank you very much. Very comprehensive, and it's a good picture. So please don't take any of the points I make as being unduly critical. You know my background. I should have said I'm Paul Stollard. I'm a new board member. So the first thing that intrigues me is the riddles. You mentioned 2 of them, but you don't mention the other 2. I would like just generally to have in your report what all the riddles are for each quarter, because they're obviously the most significant things. I'm not asking you necessarily for what the other 2 were, but it would be good to know what all, I think you had 4 in this quarter, and what they were, just as a general point. The second point is about near misses. I'm not always convinced it's a good thing when near miss reports go down. I think, in fact, near miss reports should stay constant or go up. But what you should see is they're less important, and we're getting better at reporting near misses rather than people are no longer bothering to report them. So perhaps next time you might just break down what the near misses are. I don't mean detailed, but what sorts of things they are, just to be ensured that we are still actually having an effective near miss reporting scheme. Does that sound reasonable to you, Jim? You understand the point I'm making?
Yes, absolutely, and it's something that's been discussed at various levels. We we are aware that a reduction in near misses isn't necessarily a positive thing, and so we are trying to promote that as much as we can. I think we have another piece of work that's ongoing in the promotion of near misses that goes along the same vein of employee fact sheets and putting that message back out there, which we have done previously with awareness briefings and instructions that have gone out. Again, it's about improving that culture and encouraging the reporting of all levels of near misses, which I think in general I would find that the near misses are where it's more something that significant has happened rather than those low levels. And I'll certainly look at providing a bit more sort of detail on that in future reports.
A third point, if Chair's going to be indulgent to me, is when you talk about accidents during training, I'm always intrigued to know whether those are to trainees or to trainers, because it makes a huge difference as to whether what the nature of it is. So I'd be quite interested in that to see whether it's the fact that people who are being trained are having accidents or the trainers themselves are doing it. Now, it may not be significant, and you may be able to say that all your trainers are brilliant and they don't have accidents, but it would be interesting to know that, because it makes a huge difference on the nature of the reporting.
Yeah, I can certainly take a note of that. The majority of those accidents involve the trainees rather than the trainers.
I would expect so, but I just like to have that confirmation.
Certainly.
Because otherwise it suggests there's something more seriously wrong. I think your key graphic at the beginning of your report, which sort of has your performance indicators and your ups and downs, is very good. But I always find it slightly difficult to follow, because as I understand it, you're showing 2 quarters against the 2 quarters of the previous year, or on average of the 2 previous years. What I'd be interested to know is there sufficient difference between quarters that we need to do that level of quarter comparison? Does the health and safety incident profile vary sufficiently between the 4 quarters or not? Now, it may do because of bad weather and bonfire night and things, but I just don't know, because if it doesn't, then that might be an unnecessary confusion. I just wonder about that.
Yeah, so I think again that was something that was requested of us previously, to look at comparative quarters from the previous year. So that's probably why that graphic is there in that format at the moment. But what we've also realised and tried to do is provide a bit more context in terms of the longer term trends and the detail that follows through the report with those trend lines over the 2 years.
Jim, you certainly provide lots of detail. There's no harm in that, though we may come on to it when the length of the entire report, and some of the detail is a bit statistics when you're only getting a small number of incidents. I'm cautious about, because they don't have any great meaning. If you're only dealing with a small number of riddles, then you're bound to get a fluctuation year on year. But generally, this is really good. I want to be positive about this. With the chair's permission, and maybe with John's permission, very happy, Jim, to meet with you. I think you know my background, and I'm very happy to meet with you or John, whoever, if that would be useful outside this meeting. There's just an offer on the table.
Yeah, I'm sure we'd welcome that, Paul. Thank you.
Just before I bring John in, there's a couple of reflections that I would give to my committee members. And first is that we've had contradictory messages just now. One is about changing reports and one is reducing reports. So can I just suggest that first action I think that we need to take, and it feeds into Paul's offer, and that is, I think the committee themselves, as we've already indicated, need to get together to decide what it is we're actually asking from the executive and from their teams, because I am very conscious that we're having a bit of mixed messaging going on here. So rather than moving to change things in any sense between now and the next committee, Ali, I think we've already talked about it, but if we can take an action that's specifically to pick this up in the new year with the committee, whether that's at the annual workshop or at some other form of event, can we do that? And can we do that with some degree of haste, i.e. before maybe the end of February, so that we can reconcile our ask to the committee? In principle, though, I'm happy to be guided by John and by Paul and by Jim in terms of whether or not that's constructive. I would just put it in the context that I think it needs to be in that broader conversation around what is it as a committee we are asking for. And on that note, can I bring John back in? And Paul, is that a new hand or is that an old hand?
Old hand.
Grand. John, do you want to come in? Sorry. And then we'll go to Malcolm.
Thank you, Chair. John Dickey, Director of TSA. Paul, thank you very much for your comments. And Chair, I know all the comments that you just made there regarding what's in and what's out, etc. Paul, after the last meeting, we never managed to meet, but I did. I was looking to hopefully meet up with you and the team. So absolutely, we really, both Julie and Jim and I would love to meet with you off table and refine that. Knowing your background, I think it could only improve what we do and what we deliver with regards to our strategy for health and safety, but in particular how we report performance data, and getting it right for this committee is extremely important. So I noted everything you'd asked for today. I see benefit in them all, but the flip side of that was just when Steve's comment earlier on about maybe trying to reduce it. So more than happy to sit off table and discuss that, though, out with the meeting that the chair is recommending we do as well. We could do that some preparatory work, I think, which would get us into a really good position for a workshop or an extraordinary meeting. So thank you very much for the offer, Paul, and we'll definitely take that up on you.
Very happy to do that, and I can probably suggest some things that you could, in fact, downgrade as well to keep it.
Great, thank you. Thanks, Chair.
Thank you both. Malcolm, and then we're going to move on to the next item.
Thanks, Harry. Yeah. First, on that question of reviewing the reports and the length of them, one thing that would be helpful, I think, and it's maybe been mentioned before, is knowing how much of that is needed anyway for other committees' levels of scrutiny and approval or whatever, and how much is just being done for the benefit of this board. So that's just a thought to throw into that mix as we're doing the review. I was really pleased to hear that work is going on low speed accidents. I think I'd picked that up from somewhere else already, because I think that's one that's been mentioned, and it's good to hear the work that's going on that. So look forward to hearing some of the outcomes of that in due course. Just one specific point I want to mention. It's on, you don't need to look it up, page 90 of the report says there continues to be a significant increase in the number of health and safety events with no information available. So I just wondered, is that something we can do something about so that we're reducing the number that there are with no information available and getting a bit more insight into some of that? Thank you.
Yes, it's something we're working hard to reduce the number with no information. That's in relation to working days lost, as I mentioned, and it does have an impact on the other stats that are provided on that page if there's so much with nothing there. So we're putting that message out on a regular basis throughout the service to ensure that that's recorded on the health and safety management system. So hopefully we will see improvements.
No, that's really helpful, and I can't speak on behalf of the whole committee, but certainly if you need our weight behind that to say it's important, then I'm sure we'd all be supportive of that. Thank you.
Thank you, Malcolm. On that note then, can I just say a huge thank you to everybody who's involved in compiling the reports, regardless to some extent of the length of them. We do appreciate the detail and the effort that goes into them. As you can tell, we are still a relatively new committee, except for Malcolm, he doesn't get a pass on that, but the rest of us are still finding our own way to some extent. And as you can see, I think we're signalling that we would like to have the conversation about potentially some of the changes around reporting. I don't think that's new. That won't come as a shock to Liz or to John, I suspect. It's just a question of balancing that off at the moment with the work pressures that we know that everybody's facing. But by and large, I think I can speak for the rest of the committee to say that we do feel assured and we do appreciate your time and effort in those. So thank you to all. Okay, then let's move on then to our next agenda item. And I think, Kenny, it's back with yourself for the Independent Audit Inspection Action Plan.
Thanks, Chair. It's Area Commander Kenny Barber, Head of Training Delivery within the Training, Safety and Assurance Directorate. Committee, within Appendix A of the report, provides you with a dashboard of all the current live action plans that's for noting. Today I'll give you an update on the HMFSI thematic action plan for training of retained duty system personnel. The report was published in March 2020, and contains a total of 37 actions to be addressed, with 22 recommendations raised. These are all contained within Appendix B of the report. Of the 22 recommendations, it's noted that no action was identified for 6 of these actions. In relation to the plan over the previous reporting period, I can confirm that there's been pretty good progress. We've closed or completed a further 2 actions, those being 10.2 and 11.2. I think, as I touched on in an earlier report, I think it's worthy of note of the progress that teams have managed to make in relation to the other actions. There has been some steady progress made across all the actions, and taking cognizance of the amount of resources that was realigned and the delivery and preparation for COP26. I think it's a credit to the team that they've been able to keep a focus and maintenance on that. In terms of overall progress of the plan, there was an additional 2% of the plan completed within the reporting period, and there remains 8 actions in progress, all of which I'm pleased to advise are currently all on target. So in terms of the recommendation of the report, ask committee members to note the progress and to scrutinise the training of the VDS action plan that's attached within Appendix B. And I'm happy to take any questions, Chair.
Thank you, Kenny. And well done on the progress of closing another 2 actions. And I think actually your reflections on the fact that that's been undertaken at a time during COP, and of course the ongoing pandemic is well made. Are there any comments or queries for scrutiny from the committee? No. Okay, I wasn't sure, Paul, if you were looking for your unmute button there for a second or not. But no, it looks all good.
I'm trying to read the paper in front of me. That's the point.
Yeah. Fair enough. I don't think there's any further questions from the committee, Kenny, so can I just extend again a thanks for that, and if you could pass that on to the team as well, that would be much appreciated.
Thanks, Chair.
Ali's just reminded me, but I was thinking the same, Ali, that I think what we might do is take a little break just now. If we can come back then bang on 3 o'clock, I would appreciate it. That's a full 7 minutes. That's a slow boiling kettle, not just a faxing kettle. But if we could come back then at 3 o'clock. Okay, so we will move on to the workforce data update, depending on your preference. This report for the committee is for scrutiny, and Jason will take us forward. Jason, I'm hoping that you're back.
Chair, just to confirm, it's Karen that's going to be taking us through this particular item. I'll just confirm that she's in the meetings with that break.
No, Karen this year, Ali, sorry, and I do remember that I'm just not having a very good afternoon, Karen, my apologies. Karen, it would be useful, because there's not necessarily a cover paper with this, if there's any particular areas when you're introducing it that you would like the board to pay particular attention to, it would be useful if you could draw our attention. And I'll hand over to you. Thank you.
I will do. Thank you. Good afternoon. What I plan to do is just give a brief overview of the paper. Hopefully you've had an opportunity to look over it, and then I'll invite any questions towards the end. So section 1 of the report is really highlighting the main workforce data summary. And as you can see, we are currently sitting under the target operating model for all staff groups. We are scoping recovery plans to address that, and in particular, just moving through to section 2 of the paper, We specifically are looking at whole-time firefighter intakes. We are reviewing and over the recent months have been looking at the potential to increase the whole-time firefighter intakes to keep up with the leaver profile, and also to build in some recovery, given that intakes have had to be reduced over the last 18 months due to COVID restrictions. Our current vacancy position, and I'm conscious that this update was the stats at the end of September, so while I'm probably referencing more up-to-date figures, our current vacancy position is sitting at 103, our deferred leavers at 124, and our projected leavers within 2022 is 209. Given those numbers, and we are given recognition to the fact that the pensions remedy is likely to further impact our retirement profile, we have, together with training colleagues, scoped a recovery proposal, and a paper recently went to SLT, which has given us approval to increase our January intake to a figure of 72. However, the actual onboarding of candidates, because we're sitting at unconditional offer stage, is likely to be around 67. So that intake in January, while indicated to be 48, looks to be around the 67 figure. Our proposal for the remainder of the intakes for 2022 is subject to a number of considerations, and one of them is reducing social distancing from 2 metres to 1 metre. We're currently having some further discussions with stakeholders around about that, and whether that in fact will be feasible, given the current additional variant that has raised its head, and what potential impact that may have. So our proposal is that we will bring some further plans back to various governance boards as soon as we settle on what is an appropriate plan for those increased intakes. In terms of our VDS, we do have a historical issue with the vacancy gap, and you'll be aware of the work that the RVDS Forum is doing, and now with the project board that has been established to further support that. Ourselves as a HROD function are working closely with the forum and the project team to bring about some process improvements, both to enhance the recruitment journey for a candidate, the communication internally within the service to make sure that the current status of a candidate is immediately visible to the recruiting manager as well as to ourselves as the resourcing team. The pre-employment engagement programme, we are working with health and wellbeing colleagues and the project team to embed the arrangements around about that, and are initially seeing some good feedback on that basis, but there is some further work to be done in that regard. Support staff, business as usual activity, and the progression of the BC Tag business cases that were approved is progressing. Again, we are trying to streamline our recruitment activity around about that to be slicker and quicker and how we onboard our staff. We are experiencing some challenges due to current market conditions. It's proven difficult to attract candidates, and we're looking at options and avenues to further explore that and open up the opportunities within the market. So that is a brief summary just as to our recovery activity. I can now invite any questions.
Thank you, Karen. Are there any questions from the committee? Fiona?
Yeah, I just wondered, how long have we been operating under target operating model? It feels to me quite a long time, but I just wondered, when were we last at full Tom?
I'm going to say, Fiona, off the top of my head, I'm going to, not in my time since I joined the service 7 or 8 years ago. It is the budgeted structure that we do operate to, but we have had difficulty and over the years specifically to attain that target operating model.
Yeah, no, I couldn't remember it in my time, and that's 6 years, but I just wondered if that was correct.
I think Stuart wants to come in there, and then Liz.
Yeah, just on that point, Fiona,
don't think we've ever managed to get to the target operating model. We got very, very close, probably about 2 years ago, just before the pandemic. And then obviously the pandemic happened, and then we've not been able to recruit the similar numbers that we need to maintain that. So
yeah, okay, that's what I thought. Thank you.
Liz, your hand went down, so I don't know if you...
Yeah, Stuart said what I was going to say, so I won't repeat it. Thanks.
That's all right. Steve, do you want to come in?
Thanks, Chair. Steve Baden, board member. The RVDS numbers are historically low. I recognise that, and I have some feel for the difficulties in attracting and retaining RVDS staff in rural areas. I do have some feel for it, but at what point do these numbers begin to feel like a crisis? At what point do we get very uncomfortable about being able to maintain services? Are we anywhere near it?
We, together with central staffing colleagues and service delivery colleagues, we monitor what the hotspot areas are and where we can identify candidates that have applied for those locations. We very much look to fast track those candidates through the process in the effort to ensure that ongoing appliance and operational availability is maintained in the areas. We are undertaking together with the project team, a review of the establishment, so what the target operating model is for our VDS. It is historical. Is it a true reflection of what is actually required? It is the piece of work that is being progressed to identify if indeed the vacancy gap is needed. Our efforts are needed to recruit to that level, which the view is it's not. But we will hopefully in kind of the next year be able to identify that true target operating model for our VDS. But in terms of operational availability, no key concerns at present. That there are sporadic areas that we engage with local service delivery areas on, and they will bolster their attraction strategy by going out to encourage hopefully some further candidate applications.
Liz, do you want to come in on that, and then Stuart?
Yeah, Stuart's probably going to add more science to it than me, but it was just to add to what Karen was saying, that one of the ways we are solving it is to, as she says, recruit specifically in areas where there is a particular crisis, but don't misunderstand that it's a careful balancing act on an almost daily basis to make sure that we stay resilient, because clearly the numbers are well below where they need to be. But Karen's right. Once we've done the full review, we may not be in a position where we need those straight numbers again, and we're looking at better ways of doing it, because clearly people are not living and working in the same areas the way they used to be. So we're kind of pushing against a brick wall to some degree at the moment, albeit that we are improving the situation, but it's within the current model, which is really not what we need. We really need a new model. But the reason we haven't hit crisis point, to answer the question, is that we very carefully juggle it every single day. But I'll let Stuart maybe add to that.
Yeah, there's not much more I could add to that, Liz, aside from saying that you're right, we're not at crisis point, Stephen. There are pockets where we have issues, but we are working collegiately with HR to address those and put in place things like the pre-engagement programme quickly, that we can attract more people to those posts. We do have a number of stations that have had availability issues and have not been available because of staffing issues. But as I say, we try and plug those gaps as soon as we can. Perhaps just add a little bit of detail in terms of the programme board that Karen alluded to. So I chair that programme board, and there's a number of projects that sit beneath that will make the RVDS more attractive, more sustainable going forward. I saw the dossiers from the individual projects yesterday, and those have been approved and taken forward, and I'm really quite enthused and optimistic about the ambition of the team to actually take forward some real meaningful initiatives that will make a difference to the RVDS going forward. It won't happen overnight, but we're certainly all pointing in the same direction underneath that programme board to try and make it happen.
Thanks, Stuart. Steve, does that answer your question?
It does, yes, thank you. And I'm reassured, and that's the important thing. I suppose it leaves a question in my mind about the visibility that the board have over those stations which have had to be withdrawn from service. But I'm guessing that probably going to Service Delivery Committee rather than here.
Correct, yes, that gets reported to Service Delivery Committee.
Thank you.
Can I just ask for my own clarity as well, in terms of that review of the TOM as it relates to RVDS, is that governance route wise, does that go through Service Delivery as well?
That will go through the Change Committee, I think,
Yeah.
because it's part of the programme board. So Fiona's nodding, so that's correct, yeah.
Any other questions? Okay, thank you, Karen. Thank you, everybody.
Thank you.
That's great. We'll move on then to the next item, which is agenda 9, workforce. Oh no, sorry, we've just done that one. I'm catching up with myself. For number 10, that's in partnership working, and that's the update from Steve in relation to the Employer Partnership Forum. I don't know if there is much of an update to give, Steve.
The update I gave to Ransk this morning was lengthy, Mary. I think, could I take your guidance as to how much of that needs to be aired again? I think it was well covered this morning.
I think it was well covered this morning, Stephen. I think at this point in time, it's nothing from what you said this morning, that the main update is really just to say it's under review and there's some work going on off table to potentially bring back an update at the next meeting.
Yes, that would be fine. Thank you.
No problem. Liz, is there anything under 10.2 then that you want to add in terms of the PAG?
No, there isn't.
That was nice and straightforward. So we'll move on then to agenda item 11, which is the aligned directorate risks. And Liz, I think that's over to yourself again.
Yeah, and I again, you know, brief unless there's discussion, but the report is there. There is nothing significant that I feel the need to call out compared to the last report. So it is what it is what I would say. So unless there's any questions, there's no point in me commenting just for the sake of it.
Thank you, Liz. Can I ask the committee, first of all, are there any questions in terms of the content of the report? And then secondly, are there any areas that you think are worthy of spotlighting for future meetings? I will take a general level of silence to be that everybody is relatively content and that there is not currently anything in relation to the risk register you would like a spotlight on. Liz, just looking ahead then, is there anything that you yourself would highlight as potentially a spotlight area for future?
Not well. I think if I look at, so I'm just running through the numbers. I think possibly the numbers element. So under staff recruitment. So I think, you know, where we potentially do get to a crisis point with any of those, but I wouldn't want to be signposting them just now. What I would probably do is reassure you that we keep a daily, very close eye on. So that would be risk 4, pod 4. We are keeping a very close eye on those on the development of that situation, and that would be one that I would pull out if it did tip the other way. But at that state, at this point in time, it's not at that stage. So that's the only thing that I think is possibly a risk. Maybe the other thing to think about is the pod 11, the pay awards element, given that we're probably just on the cusp of going with a formal offer on support staff pay. There might be some challenge there, I don't know. So really those are the only two comments, unless any of my team have got any other view.
I'll give a minute then for the committee to consider that. Malcolm, you've got your hand up, and then we'll bring in Stuart and we'll come back to this point.
Thanks, no, just in response to that question, I just noted that under new Directorate risks in Appendix 1G, the training resources, is that there is a risk of there being insufficient facilities available to deliver training. The target risk rating is 4, the current risk is 16. So just in glancing through it, that's quite a big gap. I wondered if at some point it's worth getting some information about what we're doing to try to move that forward. So that was just one I noted in looking through. Thanks.
Thanks, Malcolm. Stuart, do you want to come in, and then we can come back to the spotlight?
Just to follow on from Liz's point in terms of that staff attraction part, and recognising the discussion we had on the RVDS, is there value in a more detailed discussion coming back in terms of what we're doing for the RDS? I don't want to tread on the toes of the Change Committee, but I think there's things for this committee that would probably be of value to hear.
Yeah, so I was circling in part, not necessarily with a disregard to either of the other suggestions, but based on the previous conversation, I would agree, Stuart, that it might be useful for us to have a look at RVDS. But Fiona, you're the chair, so I'm quite happy to take your steer on that.
Yeah, I think it would be useful for this committee. It's there is a slightly different slant that this committee is particularly interested in. So yeah, I think that's a good idea.
If you aren't, or if nobody is objecting, then Liz and Stuart, I guess I'm looking particularly at you guys. I think it would be useful to see a people-specific slant around the risks associated with recruitment and RVDS as well. Steve, do you want to come in?
I guess in trying to do our job here as non-execs and scrutiny and challenge and so on, it's hard to go past this paper without noting that capacity and training capacity are both at red and both at 16. While we've heard some reassuring statements from officers about what's being done to address that, as I say, it's hard to go beyond the paper without noting that in the minute somewhere.
I think what we'll do then is pick up on Steve's point. Is there somebody who can come back and address that specifically, and then we'll have a look at what we're going to have a look at next.
I mean, I can see John wants to come in. My only observation of that is the main risk there is COVID. So the current situation is A, COVID backlog, and B, current COVID ongoing restrictions. So I think if that all stayed the same, so if COVID didn't get any worse than it is just now, then eventually that position will improve, and we've got a very clear plan in order to improve that. The caveat that would make that risk worse is if we had some kind of other more dramatic impact of COVID further into the winter. So that's really the main issue, and that would include either external restrictions or further restrictions applied to us and how we operate, or if our staff became ill in any numbers. So, but I'll let John give you more specifics, but that was my overarching view.
Chair,
John, yeah,
Chair, thanks. Thanks for your comments, Steve. Yeah, there are a couple of there that are shown red for facilities and for training in particular, capacity. I'm more than happy to pick up on any of them, but as Liz has rightly said, there's a huge COVID impact on them, on the COVID restrictions that are in place and their ability within the facilities we've got. But in particular to the one that Malcolm's talking about, and I'll come back to that one, which is about Section 19 of the Road Safety Act. I'll come back to that one. We are taking huge steps in trying to alleviate these issues and looking at our premises where we might be able to reduce to 1 metre, and working with the health and safety team and the training team to see where we can do that. So I'm more than happy if I spotlight at the next People's Committee on one or indeed two of them. I'm quite content with that. I'm content that as a directorate, it's supported by the rest of the directors and their directorates, we're doing everything we can to alleviate the problems that we've got, which are all stemming from COVID and the COVID restrictions that are in place with regards social distancing within internally. That's severely compounded by the recovery plans that are in place, which was also compounded by preparation work that was required for COP and other things that have happened in the year. So as Kenny has highlighted throughout the training report earlier on, the agility of everyone within the service to try and alleviate some of these problems has been documented, and I'm more than happy to go through that. So if we want to choose one of them for next time, that's absolutely no problem. My suggestion regards the one that I think Malcolm was talking about, which was TSA 008, was about the Section 19 Road Safety Act. That's not been enacted yet, Malcolm. We are preparing work for that. There's a lot of work getting done, and our driver training team, led by Kenny, are heading up that work as part of engagement with the UK DFT to ensure we're trying to get some exemptions for Scotland, because we don't feel it's working correctly, or it will work correctly within Scotland. So my suggestion would be maybe to hold that one over until there's a decision taken, because it's not been enacted yet. We are merely highlighting this as a potential risk, and if the changes do come in and we do not get the exemptions that we're asking for, and that's the 3 blue light service or the 2 blue light services in Scotland, then it will have an impact on us, and it will have a huge impact on our ability to do driver training and reaccreditation. But may I suggest that it's not ready for that kind of scrutiny just yet, because it's not happened.
Okay, I think if we try and pull this together, Malcolm, are you content with that potentially coming to a later meeting?
Absolutely, yeah. I just, again, it's what Steve was saying about the role of scrutiny. When I see that gap between where we're aiming and where we are, you know, I think it's worth flagging up. But absolutely, I remember some of that conversation before about the, you know, wondering what's happening in the legislation sort of thing and needing that. So yeah, absolutely happy with that coming to a later meeting.
Okay, just before then, I propose we go. Steve, do you want to come in?
Just to say that perhaps the way to tackle this as a committee is to commend the efforts of the organisation in maintaining such a high level of service given these challenges.
Yeah, I think that should be an underlying message, I think, throughout the Steve so well made. I would suggest if Malcolm's content to carry that one over to a later point, then we'll take advice from John as the subject expert as to when it's appropriate for that to come back. Just highlighting that risk runs throughout. You can see that from risk register throughout everything that we're looking at. I do get the sense though that there is an interest in the RVDS one potentially coming back. And again, what I would say is it would be useful if we could come back to the next one, but I am content to take it when you think it's appropriate and given levels of workloads. But it is, as you can see, an area of interest for us as a committee to just seek some additional reassurance around how that's managed for our own information, as well as that ongoing piece of assurance as well. I think I've covered all I need to within that item. Pause for a second in case somebody else wants to jump in. No? Okay. In which case, thank you, Liz. Thank you, everybody involved in the risk management processes. And referring back to Steve's earlier comment, I think it's impressive that you're able to manage that degree of risk so competently as well. So well done. If we can, then we'll move on to the forward planning section. So we've got a number of items under here. We've got 12.1, which is the pod policy review schedule update, and there's an attached paper for that. And Mary, I think you're leading on this one.
Yep, thanks for that, Chair. This paper is presented to the committee for their information, and if I can refer you to section 3 of the main report, the policy schedule, which is attached at Appendix 1, gives an overview of the policy work that the Directorate have been looking at for the period up until the end of September. As usual, we always review the schedule taking into account our Directorate plan and the priorities that we have for 2021, as well as focusing on the essential policies that we need to produce or review or update, and the stakeholder engagement that we need to take part in order to move our policies forward. Under section 3.2, during Q2, we published 7 policies on our iHub, and those included the management of health conditions, our whole-time uniformed instructors, employees, working hours and leave policy, driver's health assessment, flexible working, home working, which, as you know, is linked to our agile working framework, attendance management policy, which was also accompanied by a new procedure and an updated handbook, and an amended purchase of additional annual leave policy. During the same quarter, we also published a further 3 policies for consultation, and those included pre-placement, re-employment policy, along with our working together framework and the associated policies. With regard to the working together framework, that will come back to the SLT meeting in February following some recent engagement with the rep bodies. However, the consultation and negotiation procedure are both progressing through our governance route. In terms of our agile working framework, during the period we launched a number of drop-in sessions, 9 in total, and 188 employees attended those sessions, and that was a mix of uniformed and support employees. At this stage, our business partners within the Directorate are now delivering the same presentation to the respective management teams in the areas in order to gather collective views and feedback into the head of pod. If I can refer you to section 3.3 in the policy, so the current period, which is Q3, we have begun work on progressing a number of documents which include a policy on health and wellbeing, vaccinations, case management, clinical audit and health and wellbeing record management. What I would like to add at this stage, Chair, is there's been some discussion in the Directorate regarding having an overarching health and wellbeing policy and a number of guidance notes that would follow out from that. So rather than those documents which are detailed at section 3.3 being separate policies in their own right, we would have one overarching health and wellbeing policy, and the following documents would become guidance notes. So that's discussions that we're having within the Directorate at this point in time. Again, during the same period, period 3, a number of policies have been issued for first consultation, and those include whistleblowing, a new family leave policy which combines our previous maternity, paternity and shared parental leave policy, as well as a new section on carers leave, and a new policy called managing employee performance, which was formerly called the capability policy. Our secondary employment policy, which I've spoke at before at this committee, is also going through our governance process, and the next stage is to have some engagement with our rep bodies in the form of a workshop that will take place early March. We did devise a short task and finish group to look at this policy, and following on from the feedback from the task and finish group, we felt that the best way to progress this document was through a short workshop with our rep bodies. So early March that will take place, and again any feedback that we get from the rep body workshop will be taken into account and considered as the document progresses through the pod Directorate management team and then ultimately People Board for approval. And finally, if I can refer you to section 3.4 in the report, I'm chairing a short working group in order to support the mental health and wellbeing group, and the purpose of that group at this point is to identify and review any policies or procedures or activities which may have an impact on mental health and wellbeing of our employees. So with this in mind, the pod Directorate have started to identify a number of our policies which would be due for review in 2022, and having a focus on mental health and wellbeing. So we've reviewed our policy schedule. Some of the policies will have to be changed, some of the timescales will have to be reviewed, and any final proposals on that decision will be presented to our pod managers meeting, or sorry, it was presented to our pod managers meeting in October. There is a further piece of work to take this forward, and again any findings or final outcomes from that will be presented to our pod Directorate management people board and ultimately people committee. And a similar exercise is also being carried out by all members of this subgroup, so whether it's service delivery, operations, SPP, etc., all members of that group are carrying out the same exercise with relation to their own strategic documents and policies, etc. So that's all I had to say at this point, Chair, on the policy schedule for Q2. I'm happy to take any comments or any questions. Thank you.
Thank you, Mary. All I would say to the board is that this is for information. So, Paul, do you want to come in?
A very small point. We had a board development day recently with a piece on corporate parenting, at which it was raised, at least I raised the issue about members of staff who have roles either on children's panels or similar sort of activity. I wondered if that came into your point about secondary employment, or whether it's covered in that policy, or is there a separate policy on that?
Sorry, what was your question, Paul?
At the Board Strategic Development Day, about 10 days ago, we talked about corporate parenting, and I raised the issue of members of staff who are on children's panels or have some sort of public role like that. And I wondered if that was covered by your secondary employment policy, or is there a separate policy which deals with that?
Yeah, the secondary employment policy, Paul, will cover all employee groups, whether they're support staff, uniformed, etc., all employee groups, regardless of what the secondary employment may be. So if it's HGV drivers, for example, are for RDS employees, if RDS employees have secondary jobs, or if it's support staff members who also have a role like being on the children's panel, that will cover any sort of role, no matter what the secondary role is.
Even if it's unpaid?
Yes, so it's about, so there's a declaration of interest that people make if they're doing these things, just to make sure it doesn't clash with their employment. So, for example, there's no conflict of interest or whatever. So we have a combination of the policy that covers secondary employment and the time off for special occasions, etc., whether that be volunteering, so territorial army, for example, being a classic example. So between the two of those, that's where they're covered.
Thanks.
Thanks, Paul. Any more questions? Okay, thank you, Mary.
Okay, thanks, Chair. Thank you.
We'll move on then to 12.2, which is health and safety policy and management arrangements. I think we're back with yourself, Jim.
Yeah, thank you, Chair. Once again, this report is submitted for information, and if I can draw your attention to the Appendix A within that report, which gives an overview of the management arrangements and policy that have been produced and published over the reporting period. I'm happy to confirm that I expect all of those arrangements to be in place by the end of the financial year in accordance with that programme. I'll draw your attention in particular to plant and equipment, which is marked as red at the moment. That is at its final review stage at the moment and should be issued for consultation in the near future. In addition to that, the event reporting, investigation management arrangement and the significant investigation management arrangement are both now out for familiarisation, so that's moved on since this report was produced. And we have a number of others. Organised events is ready to go. The COVID workplace management arrangement has recently gone through governance and is ready to go, and as is the radiation management arrangement. The reason why those haven't been published for consultation at present is just with a view to kind of staggering those across with bear in mind the number of documents that are issued, so not to overload our staff with those all at the same time. The manual handling arrangement has now been republished following review as well, so that can be marked as complete and will be in the next report. We've also started looking at our plans for next year and the years moving ahead and populating our requirements for new management arrangements and reviews. So those will be incorporated into a new report and a new financial year. And that concludes my report. Thank you.
Thank you, Jim. And as you can see, it is here for information, but I don't know if anybody has any questions. Please. Thank you, Jim. Okay, then let's move on to 12.3, which is the forward plan. So the forward plan's on page 165. There's quite a lot proposed for the March agenda. I don't know, Ali, if there's any particular reflections from yourself.
Nothing specific, Chair. So we've got our forward planning meeting scheduled. So just in terms of progress towards achieving all that, and that can be discussed at that point. And maybe one of the standing items just to reflect on an update would be in relation to the strategic risk register, just to have that more reflected now as strategic risk summary and committee aligned directorate risks. But other than that, Chair, nothing further.
Thanks, Ali. Has anybody else got any comments about the forward plan? Nope. Okay, that's good. Consideration of future items for the Integrated Governance Forum for the board or strategy meetings. Is there anything that's come up that people would like to highlight?
Sorry, Chair, I was trying to come in there. Just to, I think you're already aware, but just to make the point that we've asked for the employee consultation forum to be brought to strategy day, the next strategy day as it happens, albeit that we're discussing in the private session.
Thanks, Liz. Okay, if there's nothing else, then we will just ask Ali, can you review the actions from the meeting, please?
Certainly, Chair. So I've picked up a potential 4, but actions in total. Just running through them in order. In regard to item 7.1 of the agenda, and it was in regard to the performance and risk report under the POD section 2, developing a diverse workforce and inclusive culture. Just around the total number of grievances and discipline cases conducted within a 6-week time frame, and for those to go that go out with that aspiration as per policy. So the head of POD is to check and confirm the rationale regarding that, and it's proposed that that will be done out with the meeting, potentially via email. The committee are content with that. Second action being, again, relating to item 7.1, a further look and feedback in relation to the number of leavers and overall turnover figure to ensure they align. And again, for the head of POD to come back with that out with the meeting, and again proposed via email.
Yep.
And the third action in relation to item 7, and specifically with regard to the performance and risk report, that the People Committee to agree what has been asked for from executive colleagues around the performance reporting in level of detail, and to consider for this to be added for early February 2022.
Mm-hmm.
And final one, whether or not you want this as an action, it'd be item 11, committee aligned directorate risks. So further consideration around future spotlights on risks with the possibility of focusing on RVDS, people specific around recruitment, in particular at a future meeting. However, further discussions can be held at the forward planning meetings already scheduled, and to confirm and give executive colleagues sufficient period of notice regarding the People Committee's requests.
Yes.
That was it, Chair, unless anyone else has picked anything else up. Thank you.
Thanks, Ali. I'm going to take general silence that there's nothing further anybody wants to add to that. That seems accurate to me. Okay, thank you very much. In which case, I think that concludes our meeting in public. We've got our next meeting on the 3rd of March. So I just want to again express thank you to everybody who's input to today's meeting. We do appreciate it.